Hello guys, welcome to today's video, Symptoms and Causes for Herpes. Herpes is an infection caused by HSV, herpes simplex virus. This virus affects the external genitalia, anal region, mucosal surfaces, and skin in other parts of the body. Herpes may be a long-term condition. However, many of us never have symptoms albeit they're carrying the virus. Symptoms include blisters, ulcers, pain when urinating, cold sores, and discharge. Although there's no cure for herpes, it is often treated using medications and residential remedies. Fast facts about herpes. 1. There are two sorts of herpes simplex viruses, HSV1 herpes type 1, or oral herpes, and HSV2 herpes type 2, or genital herpes. 2. Quite 50% of individuals within us have HSV1. 3. Around 15.5% of individuals within the US aged 14 to 49 have HSV2. 4. Receiving head from somebody who has cold sores around their mouth significantly raises the danger of becoming infected. 5. It's impossible to urge herpes genitalis from a restroom seat. Symptoms. Most people don't experience symptoms for months or years after becoming infected. Those that do have symptoms during the initial period will usually notice them about 4 days after exposure. The average range is 2 to 12 days. Primary infection symptoms. Primary infection may be a term used for an epidemic of herpes genitalis that happens when an individual is first infected. The symptoms are often quite severe and should include 1. Blisters and ulceration on the external genitalia, within the vagina, or on the cervix. 2. Vaginal discharge. 3. Pain and itching. 4. Tender, enlarged lymph nodes. 5. Pain when urinating. 6. Heat, fever. 7. Malaise, feeling unwell. 8. Cold sores around the mouth. 9. Red blisters on the skin. In most cases, the ulcers will heal, and therefore the individual won't have any lasting scars. Recurrent infection symptoms. Symptoms that occur during a recurrent infection tend to be less severe and don't last as long as they are doing within the primary infection stage. Typically, symptoms will last no quite 10 days and include 1. Burning or tingling around genitals before blisters appear. 2. Women may have blisters and ulceration on the cervix. 3. Cold sores around the mouth. 4. Red blisters. Eventually, recurrences happen less often and are much less severe. Causes. When HSV is present on the surface of the skin of an infected person, it can easily be passed on to somebody else through the moist skin that lines the mouth, anus, and genitals. The virus can also spread to a different individual through other areas of skin, also because of the eyes. A human cannot become infected with HSV by touching an object, surface, washbasin, or towel that has been touched by an infected person. Infection can occur within the following ways. 1. Having unprotected vaginal or sodomy. 2. Having a head with an individual who gets cold sores. 3. Sharing sex toys. 4. Having genital contact with an infected person. The virus is presumed to be passed on just before the blister appears when it's visible, and until the blister is totally healed. HSV can still be transmitted to a different person when there are not any signs of an epidemic, although it's less likely. If a mother with herpes genitalis has sores while parturition, it's possible that the infection is going to be passed on to the baby. Please check on our next video. We'll mention treatment and prevention tips of herpes. Please don't forget to subscribe to our channel for more recommendations on health, relationship, lifestyle and other helpful information to form life easier.